So what are the indications for chest intubation? Number one is the pneumothorax, second is the hemothorax, and third is complicated pleural effusion. So these three are the main indications for chest intubation, in which we put a tube inside the chest. So the last thing, complicated effusion, I will explain it further. Now what is meant by complicated effusion? Effusion due to cancers, they need intubation, whether the primary lung cancer or the secondary lung cancer. Number second, if the Gram stain is positive and effusion is massive, and that is exudative, so this is one of the indications for chest intubation. Number third is if culture is positive, then this is one of the indication for chest intubation. If pH is less than 7.40, then this is indication for chest intubation. If the TLC count is more than 10,000, then this is direct indication for chest intubation. If there is frank pus, then this is indication for chest intubation. If the LDH level is more than 2000 in the pleural fluid, then this is one of the indication for chest intubation. Now I have summarized the causes: pneumothorax, hemothorax, and complicated effusion. By complicated effusion, I mean all of these things. So intubate the patient. Now chest extubation. When will you extubate? When will you take out the tube? Point number one, the lung is expanded. You have find out the cause and you have treated the cause, and now the lung is expanded. Second thing is you have given clamping trial, and there was no recurrence of the actual disease. There was no lung collapse, there was no pneumothorax. So first thing is the lung is expanded. Second thing is there is a clamping trial. You clamped the tube. Let's suppose this is the lung, this is the pleural space, and there was tube inside there. So the first thing was the lung is expanded. The second thing is when you clamp this tube, it means it is just like the lung in which there is no tube. So, and then you do X-ray after some time and you look for the recurrence. If there is a recurrence of the pneumothorax and there is the lung is collapsing again, so you remove that clamp and wait again and find out the cause, whether the cause has been treated or not. So you find the cause, you treat the cause, then you look at the lung that is expanded or not, then you give clamping trial. If the clamping trial is successful mean you block the tube, and when that X-ray the lung was still in expanded position, there was no recurrence of the pneumothorax or collapsing of the lung. So this is successful trial, then you remove the tube. If this is unsuccessful, mean there is recurrence, then wait and treat. Do not extubate. Now you have passed the tube and the lung is not expanding. So what are the causes? You have passed the tube and the lung is not expanding. Point number one, address the cause again. What was the cause? Point number two, apply the negative suction. Even if it is not expanding with the negative suction, the third step is cardiothoracic surgery. Cardiothoracic surgery. Now these things must be followed. You have passed the tube and still the lung is not expanding. Point number 1, address the cause and treat the cause. Point number 2, negative suction. Apply the negative suction and wait for some time. If with the negative suction the lung is still not expanding, then the third option you are having cardiothoracic surgery. Cardiothoracic surgery.